Hips and low back. Now, some of these you'll be able to do during your workday. One of these you'll have to do at home or out in a parking, in a park, a nice sunny park. So the first thing is to recognize that you're squatting, you're lunging, you're leaning on one side a lot, and these side of the hip muscles get really overused, while the inner muscles don't get touched, don't get active all that much. So we're going to balance that, and it'll help you be more limber in your joints. So the first thing is just below your belt line, not back here with your butt, but on the side, take your knuckles, the tops of your hands, put your knuckles into your glutes, the glute medius, the medial, the side glute, and massage. Wiggle it off. The aim here is that you release the tension in your hips. It doesn't take too long. It might feel cool or open or very, very relaxed down your legs. So a little bit of that can go a long way if you are just trying to get through your day or you've got some built up tension. You can move your hands back behind you anywhere that it feels good. You can do this. You can even hit, and that's really, really great. And a little bit of shoulder mobility with that as well. The second movement is knee circles. There's two ways to do knee circles. First is the old classic PE warm up. Slower is better. A few in each direction. Now, eventually, you can make this bigger and bigger as long as your knees don't feel any pain. But this is a really great one to get a lot of mobility happening through your hips that wouldn't normally happen when you're squatting and bending and doing those things. But the other knee circle, and I'm going to cheat a little bit, it's really a hip circle, is to draw a circle with your knees. Now, if you get a lot of crunchiness or beta pops, make the movement smaller and play with turning your foot, turning your foot, turning your foot in, turning your foot out, or changing direction. Now you can do this laying down as well. But the main point of this is you're getting your ankle, your knee, and your hip all moving and getting the tissues to do some different lengths in movement. And that's what makes your brain go, aha, that's how that works. We want to keep that. And then you move better for many hours. The next movement is really simple. You don't even see anything, but you put your feet a little bit apart, about shoulder width or so. It doesn't really matter as long as they're not touching. And then you gently squeeze together, like you're trying to push the floor together. If you're on carpet, you're trying to bunch that carpet up between your feet. You're not going to go anywhere, but you'll feel it in your inner thighs. Now hold that for a few seconds. And there's an advanced piece to this too, which is to bend your knees just a little bit and make sure that your hips are not tilted forward, but they're actually, you tilt them back a little bit as if you're trying to float. So legs squeeze together, bend your knees just a little bit as if you're trying to float on your pelvis. That makes sure that your spine is more or less straight up out of your pelvis, and then your head can relax and your shoulders and chest can relax on top of a pelvis that is stabilizing. You should hold this for something like 20 seconds to 60 seconds, a minute. Usually 6 slow breaths is a great way to do it. And you'll always feel better after 6 breaths. The final movement you probably won't do until you're at home, but at home this works really great. You lay down, one leg straight, one leg bent, and then you do foot circles for about 1 minute each direction. This movement is surprisingly restorative and helpful, and it balances out a lot of the tensions in your lower leg while letting your other leg relax, but not go into a deep stretch. The reason that's so good is because a stretch, your body will tend to resist. But if you're doing rebalancing or tension reduction, your body gets to stay that way for a little bit longer. And that'll make a lot of difference in your feet. So there you go, hips and low back.